Yeah, I am Ashley. I did Pathway One. So after I graduated, being a nurse, I kind of really focused on doing this while I was working in public health. So right now, and I also was doing this back in 2014, so I've been doing it a while. Um, I started out at the public health department doing maternal child health. I was doing some stuff on like our prenatal clinic floor. And then I'm doing, it's called Baby's First in Cocoon here in Oregon. So seeing families prenatally during pregnancy, as well as kiddos 0 to 5, and then kiddos with any special health care needs, 0 to 21. So doing a lot of case management and feeding for that. I did my nursing practicum with the health department. And so I got a lot of hours through that. And then when I went on to do my bachelor's in nursing through OHSU, I was able to get my practicum at Riverbend specific to lactation. So that definitely helped getting those 1,000 hours in. And then I was just doing lots of trainings to get my 95 hours. I did some evergreen training out of Washington. I think it's with Molly Pessel. I took some graduate coursework through Wichita State. And then just kind of doing whatever I found that I could, and work was helping pay for that, which was really nice. Yeah, and I just kind of, I didn't have any kids and I was really young. And so it was all kind of new, but really interested in learning more and helping families. So right now I'm doing the same thing. It's just not through the health department. It's through like a community action network. And so I'm doing that. So I do home visits, and I am also able to see people in my office. I can go see people at the hospital as well. I kind of see people really anywhere. So some of the challenges come with people that are unhoused, living in their cars. So that's definitely, I feel like, one of the biggest challenges is working with families that don't have a whole lot of resources, and or really rural, because we're really rural. So finding referrals, like say to OT, if they don't qualify for early intervention services, which is 0 to 3 for like the PTs and the OTs, it's really hard to kind of get families to come in and see those extra, resources that they may need. Some joys are working with early intervention. So I get to do a lot of joint visits for those kiddos, working with the PT and the OT. So I get to learn a lot from them. And let's see, I do a lot of things, I feel like. So I'm the coordinator of our local breastfeeding coalition as well. So we do lots of events. We host big latch-ons. I sit on like a bunch of committees, so I really get to share about lactation where it may not always be present in certain things, and especially like for our insurance. So sitting on like the board of the CCO is really helpful to kind of educate other providers about just what we do and how supportive we are. And I know somebody mentioned in here that they're a doula in the chat, and so we're really working with the doulas and seeing how we can coordinate with them. Let's see what else. Right now, we are just working with OHSU to start doing a breastfeeding assessment of our area with the NIGHT, the Cancer Institute, and trying to figure out that. So I'm learning all kinds of things. I've never done like data work and assessments. So really partnering with them to kind of figure out how to do that, as well as writing grants to get funding to do that. So I feel like the last couple of years taking on the coordinator role of the coalition has taught me a lot, and I'm learning a lot. And then just a joy that I really like is being in the homes with families. Like it's totally different than being in the hospital, and you're going through so many different things when you're at home. And even like working on weaning and things like that as kiddos are getting older. So I think I covered